So today's session, anemia. What is anemia? Anemia happens when you do not have enough RBCs or your red blood cells don't work as they should. You may be having enough amount of RBCs, but they are immature or they are incapable of carrying oxygen. Okay, the main function of RBC is to carry oxygen throughout your body because this oxygen will go and deposit in your cells will take up this oxygen for giving you energy because mitochondria requires oxygen for oxidation to burn the ATP to give energy. Okay, so without healthy RBCs, your oxygen supply decreases. Your body will not have enough amount of energy to do its function because every cell has a mitochondria. Mitochondria is the key factor involved in giving energy out because ATP is broken into ADP in the presence of oxygen. Okay, in the presence of oxygen, ATP is broken into ADP. When this adenosine triphosphate breaks down into adenosine diphosphate, that's when energy is released. Okay, so oxygen's presence is important, but when the oxygen is not present, this breakdown of ATP into ADP don't take place at enough rate, and because of which you are deprived of energy. Without healthy RBCs that do their job, your body does not get enough energy that it requires to function properly. While some anemias are short term and mild, which you can just treat with a healthy dietary changes. Okay, but other types of anemia, we will discuss each type in detail, are inherited, are maybe as a result of some chronic inflammatory diseases. Also, you can get certain types of anemia, and they can last for the lifetime. Usually, the inherited anemia, like sickle cell anemia, thalassemia, okay. If they are left untreated, if the anemia is left untreated, it could lead to life-threatening conditions as well. Certain anemia is maybe caused because of excessive blood loss, because of some um, internal injury, internal bleeding, hemorrhages. Okay, hemorrhages means excessive bleeding. Okay, this can also lead to some life-threatening conditions. So anemia affects different people in different ways. In newborns, some infants are born with low blood cell count. Usually, when the mother was also anemic during pregnancy, or if the infant is is a low birth weight baby or a small for gestational age baby, usually they are born with quite a few red blood cell count. Okay, as compared to a healthy newborn. Most newborns will do not have they do not require any medical treatment for anemia, but if it is a severe loss of blood or severely low RBC count, in that case, newborn may require some blood transfusion. So that could go to a life-threatening condition. So in that situation, blood transfusion may be required. Infants may get less iron as they need when they start eating solid food because breast milk does not have iron in it. Okay, the first 6 months of the life, the infant survives on the iron that it has achieved from the mother's diet, in the which is deposited in the liver. That iron will take care of the child's first 6 months of age. Okay, after that, the iron requirement completely depends on the weaning diet that you have introduced your child into. When you slowly start giving them solid food apart from breast milk, okay, along with breast milk, when new food is introduced in the child's diet, it should be calcium, iron, and protein focused food. Okay, so if the infant is not having adequate amount of iron rich food, they could go into an anemic state. And because the iron in solid food isn't absorbed that easily, because non-vegetarian food is the iron present in non-vegetarian food is easy to absorb, but when the child is about 8.5, 9 months of age, okay, in some cases, if the child has severe gastric disorders, okay, in that case, up till the age of 10 months, you will not give the child non-vegetarian food. Okay, eggs can be still given, but other non-vegetarian food cannot be given. So the plant-based diet is the only source of child's iron requirement. And iron getting absorbed from a plant-based diet again is a very tricky part. Okay, so infants with anemia may appear very lethargic. Lethargic means tired. They do not have that zest. They do not have that vitality. Okay, Children, they do a lot of growing between the age birth and to age of 2, that is toddler age group. So they, whenever they go through any growth spurts, they require more iron, because when the body's size increases in terms of height and width, blood volume also increases. To keep up with the increased blood volume, increased plasma volume, iron intake should also increase. So children with anemia may develop any problems such as delayed development of motor skills, growth retardation, issues with learning, memory losses. Okay. Women who are pregnant may develop iron deficiency anemia. Again, the reason being, during pregnancy, a woman's body goes through a lot of physiological changes. Her uh, the blood volume increases, cardiac output increases. Okay, blood almost doubles. The amount of blood present in the pregnant woman almost doubles throughout the entire pregnancy. So, with this increase in the plasma volume, increase in the blood volume, definitely iron requirement should also increase to keep up with the with the production of increased amount of RBCs as well. Okay, and if the pregnant woman is anemic or severely anemic, it will lead to other complications of pregnancy as well. It will not just affect the newborn, but it will also affect the birth and labor and also the postpartum of these mothers as well. Women and people designated as female at birth, like children born as females, by sex, okay, not by gender, by sex. Women and people who have heavy periods, like menstrual bleeding and hemorrhagia and other conditions like uterine fibroids. In these conditions also, you may lose a lot of blood, and that could lead to anemia. People 65 years of age or older, senior citizens, are more likely to develop iron deficiency because of certain inflammatory chronic diseases they may be suffering from a pretty long time. That also increases the risk of developing anemia. Inflammation increases the risk of developing anemia. And if they develop anemia, they may have heart conditions or weakness that it will make them hard to get around. First of all, anemia will make them lethargic. Already old age is also slowing them down. On top of it, anemia will slow them further. It could also lead to confusion, depression, the thinking skills, motor skills will also decrease. People with chronic conditions like any autoimmune diseases, cancers, they also may have an increased risk of anemia. So anemia is very common. 1/3 of the entire global population right now is still suffering from anemia, out of which, if you see the pie charts here, men, anemia is less common among males. For hardly 4 or 5% of men worldwide, they suffer from anemia. But when it comes to female population, 67.35%, more than half of the female population throughout the world is anemic. Coming to the types of anemia, you have nutritional anemias, inherited anemias, and anemias caused by abnormal red blood cells. We'll see each one of them. Under each of these subheadings, there are further more classifications. Nutritional anemia is because of iron deficiency, folic acid deficiency, B12 deficiency. Okay, inherited are from parents to child, from your genetics. And other anemias caused by abnormal red blood cells because of either nutritional reasons or deficiencies, or also inherited anemia. Both can also affect the anemia caused by abnormal red blood cells. Coming to nutritional anemia, pernicious anemia, one of the causes of pernicious anemia is vitamin B12 deficiency. And also it is an autoimmune conditions that prevent your body from absorbing vitamin B12. Okay. First, why this may take place? The mucous membrane of the stomach, okay, it has to secrete intrinsic factor. Okay, when there is a lack of intrinsic factor, vitamin B cannot be absorbed properly in your stomach. And when the vitamin B is not absorbed properly by the stomach, vitamin B12 is required for RBC formation in the bone marrow. Okay, because of the absence of intrinsic factors. Intrinsic factors are secreted by the stomach cells. Okay, stomach cells secrete intrinsic factor when stomach cells are either destroyed because of some ulcers, scarring, okay, or autoimmune, your immunity itself is going and destroying these healthy stomach cells, causing inflammation. Intrinsic factors will not be secreted. So with the lack of intrinsic factors, vitamin B12 is not absorbed properly, and that could lead to pernicious anemia. And also, pernicious anemia is common among vegetarians as well, because vegans and vegetarians, B12 is the sources of B12 is only from animal-based foods, not from plant-based diet. Then you have the iron deficiency anemia. From the name itself, we can understand there is iron that is deficient in the diet. They do not have enough iron to make healthy hemoglobin. And hemoglobin is substance that in your blood, because of hemoglobin, your RBCs are able to carry oxygen throughout the body. Am I audible to all? Am I audible to all? Am I audible to all? Is the screen visible now? Okay, so iron deficiency from diet, iron deficient, either the diet is low in iron, or even if the diet is rich in iron, the absorption is not taking place properly in the intestinal level. Okay, symptoms are again extreme fatigue, tiredness, weakness, irregular heartbeats, cardiac arrhythmias, shortness of breath, pale skin, chest pain, headaches, soreness of the tongues, cold hands and feet. Megaloblastic anemia or macrocytic anemia. Uh, Macrocytic anemia, one type of macrocytic anemia is megaloblastic anemia, in which it is immature, RBC is immature, okay, but it is of bigger size. Okay, again, this happens when you do not get enough amount of vitamin B12 or vitamin B9, folate or vitamin B12 is deficient in your diet, you get megaloblastic anemia. Again, in megaloblastic, it is immature. Immature RBCs are not capable of taking the oxygen ions throughout your body. That was about nutritional anemias. Coming to inherited anemia, sickle cell anemia. Sickle cell anemia changes your blood cells shape. You can see here the normal blood cell shape is almost round, but here it is a crescent shape. And along with that, hemoglobin, normal hemoglobin, you can see how it is distributed in the RBCs. But in sickle cell RBC, it is kind of distributed in a single straight line attached to each other. Hemoglobin gets attached to each other. So this is a sickle cell RBC. And this specific shape, this crescent shape of the RBCs is easy to get stuck at various parts in your blood vessels. Am I audible? Is the screen visible now? In sickle cell anemia, you can see the sickle cell RBCs in a crescent shape, C shape, crescent shape, like a crescent moon. And you can see how the hemoglobin is arranged here in sickle cell anemic cells, and how in a normal RBC, the hemoglobin is distributed. Okay, so this sickle cell shape, crescent shape, it easily gets stuck in your vascular system, in within your blood vessels. Okay, and that leads to a lot of pain as well. So people who suffer from sickle cell anemia, they are put on painkillers as well along with the treatment. Okay, along with certain treatment, they are put on painkillers as well. And this crescent shape can restrict the blood flow or block the blood flow in certain areas of your blood vessels. And usually the normal RBC is flexible in shape. It is round and flexible in shape. But the sickle cell anemic cells are very stiff in shape. Okay, they are not flexible, they are stiff, sticky, and they stick onto each other, or they block the lumen of the blood vessels and capillaries, and that leads to some other complications. Then Fanconi anemia, it's a rare blood disorder, and here it is transmitted from parents to child. It is genetic. Okay, defect in a DNA repair, or it's an autosomal recessive trait. Recessive, it's a rare. Okay, autosomal dominant diseases are much more prevalent. Autosomal recessive ones are rare. Okay, both the parents, father and mother, both should have one gene that is autosomal recessive, and that's the Fanconi anemia gene. When both the parents have it, then there are double the chance that one of the child will have Fanconi anemia. And again, the RBC, the shape and size of RBC here in Fanconi anemia is macrocytic. Okay, big RBC cells. Okay, and it in the uterus itself, when the child suffering from Fanconi anemia, fetal hemoglobin level itself is elevated when certain prenatal tests are done. Okay, increased risk of AML, leukemia, solid tumors, and aplastic anemia is also seen in children who suffer from Fanconi anemia. And the symptoms here are short stature. You can see here the animated photo of a healthy individual and a Fanconi child. They have a short height. They have low set ears, deafness, strabismus. Strabismus is a medical terminology. I'll give you the meaning of it. 1 second. It's a nerve injury, specifically about the eye control. When you want to try roll your eyes to side, okay, eyes don't look exactly in the same in the same direction. One eye may look in some other, like squint eyes, something very similar to squint eye. Yeah, squint eyes. Skin hypopigmentation. Even in anemia, pale skin is a common sight. The same pale skin is visible in Fanconi anemia as well. Renal abnormalities, kidney issues, bone marrow transplantation is a treatment here. Absent or hypoplastic thumb. Thumb of the child is either absent or it is hypoplastic. It has not grown fully. It is a very small thumb. Okay, that is these are the symptoms of Fanconi anemia. Then diamond blackfan anemia. This is again an inherited disorder, transmitted from parents to, it goes from parents to child, and it keeps your bone marrow from making enough amount of RBCs, does not allow your bone marrow to produce RBC. So it's a rare congenital inborn disorder, mostly occurs in young children, and in which the bone marrow fails to produce RBCs because of a shortage of RBCs. This is called anemia. So even the blood flow, when the number of blood RBCs in the blood is below normal, it will lead to a lot of symptoms, which is very similar to any form of anemia. Okay, but there are certain classical symptoms very known to diamond blackfan anemia: protruding shoulder blades, the shoulder blades at the back. Okay, they protrude. That they look much sharper. They're protruding out. Congenital heart failure. Abnormal shortening of the neck. Neck length is quite short. Short stature is seen because of growth delay. Heart murmur. It's very similar to cardiac arrhythmia. Some heartbeats are abnormal. Even in any other type of anemia, heartbeats, the rhythm of the heart is affected. Abnormal or absent thumbs, okay, which is also seen in Fanconi anemia. Snub nose, that is round nose. Droopy eyelids. It seems like the child is always in a sleepy form. Low set ears. Small sized head. Strabismus, again, squint eyes. Widely separated eyes. The space between both the eyes is quite abnormal. Protruding upper lips. Okay, so these are the specific symptoms associated with Diamond-Blackfan anemia. Next, coming to the anemias caused by abnormal red blood cells. First is hemolytic anemia. In this, hemolytic, okay, RBCs are broken down. Lysis or lytic means breaking down. So in this anemia, your RBC cells break down or die faster than usual. Usually, the life cycle of a single RBC is around 120 days. Okay, so in hemolytic anemia, the RBCs are not able to survive up to 120 days approximately. Okay, so destruction of the RBCs way too faster. And when you do the blood smear, when the blood smear test is done in the lab, they see the broken parts of RBCs here and there. So that's how they diagnose that it's a form of hemolytic anemia. Once it is registered that it's a hemolytic anemia, then you have to find out, is it autoimmune or is it other causes? Aplastic anemia. This anemia happens when the stem cells in your bone marrow, again, they do not make enough amount of RBCs. Okay. In aplastic anemia, you can do the comparison, normal blood cells, how many RBCs are present in this animated figure, and in aplastic, very few RBCs are present along with white blood cells and platelets. Autoimmune hemolytic anemia. Here, your own immunity goes and attacks your blood RBCs. Okay, your monocytes, your macrophages, okay, whatever, it goes and attacks your RBCs. It could be because of certain medications that you are taking, or if your immunity is in a hyperreactive mode because of any underlying disease conditions. Okay, and in some cases it is idiopathic, which means we still do not know what is the exact cause that is causing your immune system to attack your own RBC. Okay. Then sideroblastic anemia. In the chapter of iron, we will see this micronutrient iron. Sideroblastic anemia. Iron toxicity leads to sideroblastic anemia. Here you do not have enough RBCs which are healthy to carry oxygen to the tissues. Okay, you have in RBCs, but majority of them are immature because they are surrounded by excess amount of ions. Okay, so here you can see sideroblastic. The terminology, sidero means iron, blastic means immature anemia, decreased amounts of healthy RBCs. So you can see here a single RBC shape and size is kind of normal, but they are immature. Okay, RBCs are immature and they carry a lot of ferrous ions on top of them, and because of which their oxygen carrying capacity is diminished. So it is immature and it's dysfunctional. They do not carry the function of carrying oxygen from point A to point B. Macrocytic anemia happens when your bone marrow makes unusually large blood cells, or red blood cells. Macrocytic. And again, they are immature. They are dysfunctional. They do not carry the oxygen carrying capacity as well. Microcytic anemia, just the opposite of it. In this anemia, the size is quite smaller than usual. Along with that, the count of the RBC is also very less as compared to normal RBCs. You can do the comparison here. The count of RBC is less. Along with that, the size of the RBC is also much smaller than a regular RBC. Normocytic anemia. In this type of anemia, again, you have a fewer RBC than usual, but those RBCs, they do not have enough amount of hemoglobin. Okay, so the pigmentation of RBC is quite less. So if it is a normocytic normochromic anemia, normochromic means the pigmentation is completely fine. It's not hypochromic. Normochromic, if the pigmentation is fine, and the normocytic, the size is also normal, but still the count of RBC is very less. So what happens? Either it could be because of two reasons. Your reticulocyte means immature RBC, which has been formed by the bone marrow. Okay, reticulocyte has nucleus. Okay, and when it is discharged into the bloodstream, it is in the form of reticulocyte RBC, and staying few days in the blood circulation, it slowly matures into RBC. Okay, so if you have appropriate normal amount of reticulocyte count, okay, correct. When you do the blood test, reticulocyte count is also seen here. Okay, so if the reticulocyte count is normal, and the reticulocyte response is also normal, it could be two reasons that could lead to normochromic anemia. One is hemolysis, breakdown of RBC because of some chronic condition, inflammation, certain medications that you may be taking, or autoimmune. And second cause could be excessive bleeding that is taking place, either because of heavy menstruation, or recently you had an accident, traumatic injury in which you lost a lot of blood, or anemic mothers giving birth, and which led to a lot of blood loss. Okay, so bleeding could also lead to normocytic normochromic anemia, in which the RBC, the size is normal, the color is also normal, but the count is very less. Anemia means what? Decreased amount of RBCs. So why did this RBCs decrease? Either healthy RBCs are getting attacked, or healthy RBCs are lost because of excessive bleeding. Okay, coming to the other side, if the reticulocyte response is inappropriate, if it is too high or too low, reticulocyte response or count of reticulocyte is, if it is too high or too low, it could be because of two reasons. Either one is because of inflammation that you are suffering from, that also chronic inflammation, not acute inflammation. A disease, an inflammatory disease you were suffering from a pretty long time, like arthritis. Okay, appendicitis will not cause much reticulocyte response. It's an acute condition. So any inflammatory disease you were suffering from a pretty long time. Okay, even cancer, that could also lead to inappropriate reticulocyte response. Okay, so any inflammatory diseases you were suffering from from a very long time, that could lead to normocytic normochromic anemia. Next is organ dysfunction, specifically your bone marrow, your endocrine system, kidneys, liver. Okay, if the liver is dysfunctional, liver is supposed to store iron. Dysfunctional liver cannot store enough amount of iron, it will be lost. So this is how normocytic or normochromic anemia diagnosis will be done. Coming to the symptoms of anemia, is it clear to all till now how much of our types of anemia we have discussed? From nutritional, inherited, and loss of RBC. So symptoms of anemia: fatigue, feeling first symptom is fatigue, that is tiredness, lethargy. If you are feeling too tired to manage your daily activities, okay, it's a most noticeable anemia symptom. Others are shortness of breath, that is dyspnea. You even if you do small activities, okay, just by climbing one flight of stairs, okay, in that also you will lose your breath. Okay, dizziness, feeling lightheaded or unsteady or feet on your feet, specifically when you are sitting for a long time and you suddenly get up, okay, and that leads to a head rush, which can cause some dizziness. That is another sign of anemia. Fast or irregular heartbeat, arrhythmias, it can only be detected using a ECG, okay, in a hospital. This is when your heart feels like it is racing or skipping the beats, heart palpitations, pounding or whooshing sound in your ear, like tinnitus. Okay, you will hear a pinning sound in your ear continuously. Okay, and this can come and go, or sometimes it will just stay. Okay, it feels like you're hearing something, but there is no sound, no external sources of sound coming by. Headache, some low migraine or low headache can be seen. Pale or yellow skin color may become paler than usual. It can be detected using your the color of the tongue, the insides of your lips, the insides of your conjunctiva. Okay. Recording of this class will be uploaded in the diseases playlist. Same channel, but the diseases class playlist. Chest pain. Something, it feels like something is pressing or squeezing your chest. Specifically, it is accompanied with shortness of breath. When you are doing some physical activities and you get shortness of breath, along with that, chest pain can also accompany. So these are the most common symptoms of anemia. Physical symptoms, there are psychological symptoms also. Irritability, okay, depression, lack of enthusiasm, lack of focus in class. Okay, those becomes your psychological symptoms. At physical level, these are the symptoms that we see commonly. Causes of anemia: anemia caused by blood loss. We will see each one of this in detail as well. Anemia caused by blood loss, anemia caused by decreased or faulty red cell production, anemia caused by destruction of red blood cells. Blood loss could be because of any hemorrhage, or even children who suffer from hookworm, tapeworm infestations. Okay, they also lose a lot of blood. Okay, we cannot diagnose anemia just by symptoms. Anemia can be diagnosed only with your blood work. Okay, with knowing these symptoms should encourage you, or should encourage you to guide someone else to go and get their complete blood count done. Okay, we will discuss about the test also. Okay, symptoms are here just to make you identify this: what is normal, what is abnormal. When you see certain things as abnormal in your clients, whenever you see, you have to guide them. You can't prescribe them, but you have to guide them to see a physician and get certain test done. Okay, so for that awareness, you should know the symptoms. So causes either through blood loss, or the RBC production itself is low, or sometimes the RBC production is correct. It is okay. The bone marrow is producing enough amount of RBC, but those RBCs are getting destroyed. Okay, so these are the three main causes of anemia. So anemia caused by blood loss, your gastrointestinal conditions like ulcers, as I mentioned. If you have peptic ulcer, there are high chances you will suffer from pernicious anemia. Peptic ulcer destroys the inside lining of the stomach, one after the other. Scarring will take place. Intrinsic factors will not be available for vitamin B12 absorption. Okay, so ulcers can lead to anemia. Hemorrhoids. Hemorrhoids are lead hemorrhoids. Through hemorrhoids also you will lose blood. Gastritis, inflammation, chronic inflammation of your stomach, cancer, stomach cancers, intestinal cancers, colon cancer. In that also, ulcers are created. Cancerous cells create ulcers that could lead to bleeding, internal bleeding, because of which a lot of blood is lost. Even in peptic ulcer, it's a wound that is created, right? Ulcer is a wound that is created with inside your mucus, wherever the mucous membranes are present. So that wound, through that wound, blood loss will take place. Anti-inflammatory drugs, non-steroidal anti-inflammatory drugs like aspirin, okay, ibuprofen is used as a common painkiller. Aspirin used by BP patients, hypertension patients. It's a blood thinner. Okay, this can also lead to ulcers and gastritis. Being on NSAIDs on a very long term, okay, that could lead to blood loss. A woman's period, specifically heavy menstruation, that could and this could also be linked to fibroids, uterine fibroids. That also leads to heavy menstruation. Even the fibroids will start to bleed every month. When we will discuss about the female reproductive system and its disorders in detail, we will discuss about fibroids. It's usually tumor. Fibroids are not cancerous. They don't spread. It stays in one particular area only, but it is tumors. Okay. It has a stalk and it has a branch coming out, and out of that branch, an entire tumor-like mass is hanging out. So that is fibroids. It's an extra growth on the uterus. Then post-trauma or surgery or after surgery. Even in surgery, blood loss is anticipated. Okay. So after surgery also, while wound healing, or during if it is C-section or vaginal delivery in which a lot of blood was lost, that also comes under anemia caused by blood loss. Post-trauma means any accidental injuries. Okay. Blood loss at delivery and the immediate postpartum period. If soon after the birth, the mother is facing through a heavy bleeding process. Okay. And usually it should be over within the first 2 weeks. Okay. Only the first week after labor, the bleeding is going on. But after that, from the second week onwards, it's a pale colored liquid that comes out. Okay. Straw colored liquid, plasma that comes out. Okay. That should not be, should not have a bad smell. It should not have a fall odor. These things are seen. It should not have pus. Okay. So these things has to be seen. So, but in some cases, mothers will bleed for continuously 2 weeks or more than that. It means she's undergoing blood loss. Next, anemia caused by decreased or faulty red blood cell production. Bone marrow and stem cell problems. We will discuss this in detail. Iron deficiency anemia. Obviously, if you're suffering from iron deficiency, enough amount of blood cells will not be produced by the bone marrow. Sickle cell anemia, RBCs, which are round, healthy RBCs which are round, they become crescent shaped and they become very stiff. Okay, healthy RBCs are round in shape and they're very flexible disc. Okay, they are disc-like round shape and they are flexible. And because of this flexibility, the RBCs don't get, they will not be sticking onto the blood vessels, or they will not block any lumen part of the blood vessels. But sickle cell anemia cells can do. They are crescent shaped, moon shaped. Okay, crescent moon shaped. So they can get stuck in tiny blood capillaries, and that could lead to pain. Vitamin deficiency anemia, specifically B12 and vitamin B9 folate deficiency, it occurs because of lack of vitamins in the body. So in this case, the white blood cells produced are quite large, megaloblastic, macrocytic, and they do not work properly. They're dysfunctional. Coming to bone marrow and stem cells problem, aplastic anemia happens when you do not have enough stem cells. Stem cells are present in the bone marrow. They give rise to RBCs after maturation and after certain processing. The stem cells form into RBCs. Okay. So if you do not have enough amount of stem cells by birth or by any bone marrow injury, okay, or any inflammation that has taken place in the bone marrow, because of which enough amount of stem cells are not produced. Okay, because all this because of your genes, either some inherited in condition you're suffering from, or you have undergone certain medications, chemotherapy, radiation, infection, multiple myeloma, you are suffering from multiple myeloma, or leukemia, that is blood cancer. Okay, in these cases, you will not have enough amount of stem cells to support the growth of RBC. Okay, so that is aplastic anemia. Aplastic means absence of stem cells, which lead to anemia. Lead poisoning. Lead is toxic to bone marrow. And if you work in an environment where lead is used, like paint industry, printing industries, okay, and if you are working in uh, any lead based perspective equipment manufacturing industries like X-ray lab coats and all, okay, in these situations also you may develop bone marrow and stem cells problem because lead is toxic to bone marrow. And even in children, if children, because of pica, some kids will try to eat the chipped paint, okay, from the wall or from any metal. If the paint chips are falling down, the children will small young children will start eating that, and that could lead to lead poisoning. Then thalassemia happens with the problem of hemoglobin formation. Body is not able to make healthy hemoglobin because of the absence of four specific chains are present, should be present to make hemoglobin. And if these four chains are absent, hemoglobin will not be formed in the body. And it makes a very small RBC, which is absent in hemoglobin. And again, thalassemia is a genetic condition. It is passed down through genes. Coming to the causes of iron deficiency anemia, a diet without iron, specifically in infants, children, teens, vegans, and vegetarians. Okay, even if your diet has iron, the quality of iron source may not be good, or you may be eating certain food combinations which are not allowing the healthy absorption of iron. Okay, certain drugs, food, and caffeinated drinks that you eat at the very same time when you're having iron supplements or iron rich food. Okay, so that could cause a conflicting absorption. Digestive conditions such as Crohn's disease, or if you have had any in Crohn's disease, your entire intestine is in an inflamed position, specifically your large intestine. Okay, colon is in an inflamed situation. Okay, that's Crohn's disease. When we will discuss about the chapter of diet in gastrointestinal diseases, we will discuss about Crohn's disease also in that chapter. Or you have your part of your stomach or small intestine removed, that could lead to iron deficiency anemia. Stomach is removed because of the stomach bypass surgery done to treat chronic obesity. Donating blood very often could lead to iron deficiency anemia. Endurance training, in which again certain antioxidants that are certain free radicals that are released because of your excessive training may go and hurt the healthy RBC. Pregnancy and breastfeeding, using up the iron in your body, and if you're not replenishing the iron through your diet, that could lead to iron deficiency anemia. Periods, heavy periods specifically. A common cause is chronic slow bleed, usually from digestive system because of ulcers, hookworm infection, tapeworm infestation. Okay, these could lead to slow bleed from the intestine. You will see the defecation that happens. The feces that you release is black tarry colored, which means blood clot was there. Okay. Anemia linked to other chronic conditions. Am I audible to all? Am I audible to all? Is the screen visible? Anemia linked to other chronic conditions. Usually, it is in the setting of a long-standing inflammation, like cancers or any long inflammatory diseases. Uh, During when you're suffering from an inflammation from a pretty long time, inflammatory proteins can slow down the bone marrow's production of RBCs, immature RBCs, and because of which in future RBC count will also be low because of the inflammatory proteins produced by your body. So in conditions like chronic kidney diseases, CKD, hypothyroidism, old age, long-term diseases like cancer, infection, lupus, diabetes, rheumatoid arthritis. Okay. In these conditions, sooner or later, the patient may develop iron deficiency anemia. Anemia caused by the destruction of blood cells when blood cells are very fragile and they have to travel from point A to point B. Okay. So when they cannot handle the stress of traveling through the blood vessels, they may burst. Hemolysis will take place. Okay. That will lead to hemolytic anemia. Causes are if your own immune system is attacking your RBCs, specifically in conditions like lupus. Lupus is a very rare condition, okay, in which your own immune system is going and attacking your RBCs. This can happen to anyone, even a child who is in the womb or a newborn. Okay. Conditions that can be passed down through your genes, like sickle cell anemia, thalassemia, thrombocytopenic purpura, okay, TTP, enlarged spleen. This can be seen in very rare cases. Okay, in enlarged spleen, they are healthy RBCs can be trapped, and it can be destroyed through hemolysis too early because the spleen, the function of the spleen is to salvage the RBCs. Okay, salvage the RBC means try to take up the iron from the RBCs and to dispose of the old RBC. Okay, so this salvaging takes place in the spleen. So an enlarged spleen could lead to trapping lot of RBCs, even the one that is not worn out. Usually, only the worn out old RBCs will be passing through the spleen to salvage the iron component from it as much as possible, heme component from it as much as possible, and then the remainder will be destroyed. Okay, but in enlarged spleen, even the am I audible? Is the screen visible? Anything that puts stress or strain on your body, such as infections, recurrent infections, taking certain drugs, any spider bite, snake bite, poisonous venom that has been afflicted you, certain foods that are toxic for you, okay, toxins from advanced liver or kidney diseases. If the liver is not functioning properly, kidneys are not functioning properly, these are supposed to filter out toxins from your body. Kidneys and livers are supposed to filter out toxins from the body. If you're suffering from any specific kidney diseases, liver diseases, this filtration is not taking place adequately. Okay, so the toxins that are left behind in the body they can go and destroy your RBC. Vascular graft, prosthetic heart valves, these are surgeries. Okay, and some certain tumors, severe burns, being around certain chemicals like lead in form of your work, hypertension, clotting disorders. Okay, So in these conditions also, RBCs can be destroyed and it could lead to anemia. Coming to the diagnosis of anemia, a complete blood count is suggested. It's a test that will measure your RBCs, your hemoglobin, and even the other blood cells in terms of your WBC. There are different types of WBC: eosinophils, basophils, neutrophils, okay, monocytes, lymphocytes. All these will be tested. The count will be checked. That is the complete blood count, CBC test. And doctor will also ask about the family, the medical history that you have, okay, after your RCBC test, and some more tests can be done later. Okay, it includes the blood smear test, in which the white blood cell count can be checked. The shape of your RBC can be checked. That is important to determine which kind of anemia, which type of anemia you're suffering from, and to look out for unusually shaped and sized cells. Reticulocyte count is also done to check immature blood cells. The healthy blood should have certain amount of reticulocyte count, immature blood cells, because this will stay in the circulation and get mature and convert themselves into RBC. So when the bone marrow is releasing RBC, it is not releasing mature form of RBC. It is releasing, the bone marrow will release reticulocytes. Reticulocytes will stay in your blood circulation for a few days and then they become mature RBC. Okay. So these are the diagnoses done to identify which type of anemia you may be suffering from. And coming to the treatment of anemia, aplastic anemia, in which bone marrow is not producing RBC. Okay, bone marrow or stem cells are not present enough to produce RBC. So here you may require medication, blood transfusion will be required, and the final treatment for this is bone marrow transplantation. Hemolytic anemia, in which RBCs are getting broken down too quickly. Okay, here medication that will hold back the immune system. Specifically, if it is an autoimmune hemolytic anemia, only then this will work. If it is a hemolysis which is not because of your immunity, this treatment will not work. Only in case of autoimmune hemolytic anemia, immunosuppressants will work. Okay, the medication given here is immunosuppressants, which suppresses your immunity. Okay. But the person taking this medication has to be very careful about infections because your immunity is suppressed. You do not have a high-end protection from your immunity. If it is caused by blood loss, then again surgery or blood transfusion will be required to fix the bleeding. Iron deficiency anemia, again you will be put on iron supplements or your titrate changes has to be monitored. Sickle cell anemia, painkillers are given because sickle cell anemia will lead to certain pain. Folic acid supplements, intermittent antibiotics are also provided. Oxygen therapy is also given. Oxygen therapy means oxygen mask is given. They may have to carry their oxygen cylinder around in severe cases of sickle cell anemia. Vitamin B12 or folate deficiency will be prescribed with supplements. Vitamin B12 and folic acid supplements will be prescribed here. If it is an autoimmune disorder, it's usually not cured. The patient will be put on medications throughout their life. Thalassemia does not usually need treatment, but only if the case is severe, they may require blood transfusion or bone marrow transplantation or surgery. Diet in anemia, iron-rich food is the first priority here. The food that has high amount of iron, meats, eggs, all green leafy vegetables, iron-fortified foods like cereals, certain milk, okay, beans, seafood, peas, green peas, dried fruits, raisins, nuts, lentils. So recommendations for anemic diet is fruits that are rich in iron like pomegranate, watermelon, custard apple, that is sitafal, apples, tomatoes. Okay, these are fruits that are rich in iron. Dry fruits such as dates, figs should be consumed on a daily basis. Okay, figs may be a little bit more costly. You can have dates on a daily basis. It is more cost effective. Nachni, Rajgira atta, jaggery, beetroot are also good sources of iron. Cooking iron food in iron vessel is helpful, but do not keep it for a long time. As soon as the cooking process is done, please transfer the food into some other container. Don't keep the cooked food in iron container for a long time. Moringa leaves are also rich in iron and uh, vitamins, drumstick leaves. Okay, and include vitamin C in your diet for better absorption of iron. The presence of vitamin C enhances the iron absorption. Workout, regularly workout, even brisk walk you do on a daily basis for 1 hour. It's very good, keeping your system healthy. Yeah, cast iron fish is also good, specifically when you're making dal and all. Okay, if you do not have a cast iron vessel, okay, cast iron fish is good. Making dal, lentils, or sabzi, sambar, curry, whatever you do. Okay, even if you want to boil rice, you can put this fish in that cast iron fish into it. As soon as the cooking is done, remove the cast iron fish from that, wash it and keep it. Okay. Not recommended. Do not eat iron-rich food along with milk or milk products. High amount of calcium that is present in milk and milk products that can interfere with iron absorption. Overcooking the food can destroy nutritional benefits as well. Specifically, green leafy vegetables, or any other vegetables. If you're overcooking it, it could destroy the nutritional benefits. Calcium and iron-rich food should not be taken together at all. If the calcium content, specifically if the calcium content in the food that you're taking is less than 200 mg, then there is no issue. But the calcium content in the food that you're taking is more than 200 mg, it will interfere with iron absorption. If it is less than 200 mg, no issues. Then tea, coffee should be avoided with meals. Gluten-rich food like wheat, refined flour, and bread, that can also interfere with iron absorption. Okay, so try to keep them separate. The meals should be separate. Alcohol, smoking, tobacco, they adversely impact the RBC health, formation and maturation. And avoid excess blood loss. Treat the cause. Specifically, if you're having heavy menstrual periods, uterine fibroids, seek help from the gynecologist. Treat it using medications or surgery. 1 minute. You can take a screenshot of this slide. Coming to the anemia supplements, you can take the supplement. It will also increase the amount of iron and hemoglobin in the body, but with prescription. Okay, ferrous sulfate comes in liquid form as well as the tablet form. Usually, the serving size is around 325 milligrams, but depends on the kind of deficiency you may be suffering from. Mild, moderate, severe deficiency of iron. Different forms, different dosages of ferrous sulfate tablets will be prescribed. Gap between meal and tea could be around 1 hour. Consult a doctor about taking iron supplements for anemia and see how they're recommending you to take it. Because nowadays, the earlier iron tablets which we used to get few years back, that had severe complications and side effects associated, like nausea, vomiting. If you take it in empty stomach, it was not fit for it. Okay, usually you will vomit, you feel nauseated. It led to constipation. There were a lot of side effects associated with iron tablets. Okay, but now the new generation tablets are much more tolerable. Okay, so see what kind of recommendations the doctor will give you based on your status or based on your client's status. Typically, it is advised to take iron tablets on empty stomach, but only if it is the newest generation of iron tablets. Okay, older generation of iron tablets is very difficult on an empty stomach. And when you're taking iron tablets, do not take it along with tea or coffee or any calcium supplements. Keep the calcium supplements for the other meal, keep the iron supplements for another meal. Okay, so you can take both the supplements the same day, but one with breakfast, one with lunch. Okay, usually do the calcium supplements in the breakfast. Okay, and iron supplements you can do in empty stomach, and after iron supplements are taken, within 1 hour or within 1.5 hours, you can take your breakfast and take the calcium supplements. 1 hour gap is also completely fine. But if you want to be too careful, keep both the supplements in two different meals. One you can take along with the breakfast, one you can take in the lunch. Empty stomach doesn't mean when you wake up, your stomach is empty. Even before lunch, okay, before lunch, when you're hungry, your stomach is empty. Okay. It may also help to increase the absorption of iron supplements if you take it with orange juice, lime juice, okay, anything that is vitamin C rich. These juices, citrus fruit juices, will enhance the absorption of iron supplements. Anemia and pregnancy. The body produces around 20 to 30% more blood during pregnancy. It means you will definitely require more iron and more vitamins during pregnancy. Blood volume is also increasing, right? So mild anemia is very normal during pregnancy. Most of the pregnant women, 80% of them, suffer from mild anemia, and that's not problematic. Yeah, after meal, you have to give at least more than 1 hour, because what type of meal did you have? Okay, that is important. If you're having something like salads, something very light, soup, salads, okay, a sandwich, something like that, if you're having, after 1 hour, you can definitely have iron supplements. But if you're having something on a heavier side, a thali, biryani, okay, something that is laden with very creamy pasta, white sauce pasta, okay, these kind of food you had, after 1 hour also, if you take iron supplements, it will not be absorbed well. So what kind of meal did you have? That is important. Okay, lighter meal, within 1 hour you can take iron supplements. So heavier meal, you have to give at least 2 to 3 hours up to take iron supplements. So mild anemia is very common during pregnancy. Severe anemia can put the baby at risk, as well as the mother also, and to the risk of having preterm baby, low birth weight baby, small for gestational age baby, these are quite high. Pregnant and anemic women are also at higher risk of blood loss and hemorrhage during labor, and they will have harder time in fighting infections after labor and even during pregnancy. During pregnancy, 27 mg of iron each day should be taken. That is a recommendation. 27 mg of iron each day. If the woman has any history, if the pregnant woman had a history of gastric bypass surgery, small bowel surgery, or if you're not able to take iron supplements because these parts of the intestine has been removed, damaged, or scarred, okay, in this situation, the doctor will suggest you to take iron through IV line, through the intravenous injections. So you can see here in the image, neonatal risk, newborn risk of having an anemic mother, low birth weight, small for gestational age, fetal distress while labor, preterm birth. After when the child grows, okay, after newborn, when the child is growing from infant, toddler to school, preschooler, okay, memory and processing disorders, intellectual disability, iron deficiency continues, okay. Coming to the maternal risk during pregnancy and before labor, during labor, after labor, preterm labor, placental abruption. Placental abruption means the placenta breaks away. Okay, even before the labor has started, the placenta breaks, bleeding begins. Okay, immediately the child has to be rescued. Okay, otherwise, if the placenta is breaking from the uterine lining, it means the child is not getting blood supply. Blood supply has been broken. Okay, the placenta is not giving enough amount of blood supply to the child to survive. So immediately in emergency, the child will be taken out as a preterm baby. Okay. Severe postpartum hemorrhage, which will last for more than 1 week or 2 weeks. Pre-eclampsia, high BP, proteinuria, swelling during pregnancy, hysterectomy. You may have to undergo a situation in which the uterus has to be removed because of excessive bleeding. Maternal shock, specifically if the mother has undergone severe bleeding, the body goes into a stage of shock. Increased ICU admission during birth, during labor or after labor. Maternal death as well, that is severe. So these are the risk of pregnancy and anemia, not just for the mother, but also for the newborn child and their future. So that's all for anemia today. If you have any queries, please mention in the chat box.